Finland is known to the world as a quiet, efficient, almost perfectly ordered country. Snow-covered forests, clean cities, punctual trains, world-class education, and a population that prides itself on self-reliance. It is not the kind of country people imagine begging anyone for help, least of all the Philippines, a tropical nation often underestimated and misunderstood. And yet, quietly, without headlines or press conferences, that is exactly what happened. It didn't begin with desperation. It began with a problem Finland never expected to face. For decades, Finland built one of the most advanced social systems on Earth. Healthcare was universal. Elderly care was humane, and public services worked with clockwork precision. But beneath that smooth surface, something was changing. Finland was aging fast. One of the fastest aging populations in Europe, in fact. Birth rates had been declining for years, while life expectancy kept rising. At first, it was manageable. Then it wasn't. Hospitals began to feel the strain. Elderly care homes quietly reduced services. Rural towns struggled to keep clinics open. Nurses were overworked. Doctors were burning out. And no matter how much Finland raised salaries or improved working conditions, young Finns simply weren't entering caregiving professions fast enough. This wasn't just a labor shortage. It was a crisis of human care. By the early 2020s, internal government reports began using words that rarely appear in Finnish policy language: unsustainable, critical, urgent. Finland needed people. Not just workers, but caregivers with patience, empathy, resilience, and cultural respect for the elderly. That's when someone mentioned the Philippines. At first, it sounded unlikely. The Philippines was halfway across the world, culturally different, tropical, noisy, emotional, everything Finland was not. But Finnish officials who had worked abroad remembered something important. Filipinos, they remembered Filipino nurses in the UK, Filipino caregivers in Japan, Filipino medical staff in the Middle East, quietly competent, deeply compassionate. No, not just for skills, but for heart. So Finland did something unprecedented. They reached out, not publicly, not loudly, but officially. Delegations were sent. Meetings were held. Memorandums were drafted. And behind closed doors, Finnish agencies began asking a question that would shock many people if they heard it plainly. How can the Philippines help us survive this? The answer wasn't simple, and it wasn't charity. It was partnership. In the Philippines, nursing and caregiving are not just professions. They're callings shaped by culture. Filipino families grow up caring for grandparents at home. Elders are spoken to with respect. Touch is not clinical. It is human. A hand on the shoulder, a warm smile, a willingness to listen to the same story for the 10th time. Finland needed that. But there was another layer to the problem. Even when Finland trained its own citizens, many left. Some went to higher-paying countries. Others shifted careers entirely. Care work was emotionally demanding, and Finnish culture, while deeply kind, tended to value emotional distance and privacy. Filipino caregivers were different. They stayed. They adapted. They learned the language. They endured winter darkness that lasted months. They smiled through loneliness. And slowly, something unexpected happened. Finnish patients began requesting Filipino caregivers by name. In elderly homes, staff noticed that residents who barely spoke started opening up. Dementia patients calmed down more easily. Mealtimes became warmer. Loneliness, one of Finland's quietest epidemics, began to ease. Doctors noticed it too. Recovery rates improved. Patient compliance increased. Even end-of-life care became gentler, more dignified. Finland wasn't just importing labor. They were importing humanity. And this is where the story takes a turn most people don't expect. The Philippines didn't simply send workers. They helped redesign care. Filipino nurses brought practices shaped by limited resources, ways to observe patients closely without relying on machines, techniques for emotional reassurance, and an instinctive ability to notice subtle changes in behavior. Finnish administrators, initially skeptical, began documenting these methods. Some were later integrated into training manuals. In one Helsinki care facility, a Finnish supervisor admitted something quietly to a visiting official. "We taught them our systems." but they taught us how to care. This wasn't a one-way exchange. Filipinos learned Finnish efficiency, structure, and precision. Finns learned Filipino warmth, adaptability, and emotional intelligence. A balance formed. But none of this was announced on the news. Because admitting you need help, especially from a country the world often underestimates, is not easy. Still, the numbers spoke for themselves. By the mid-2020s, Filipino professionals had become one of the most trusted foreign healthcare groups in Finland. Recruitment programs expanded. Language training partnerships were established. Cultural orientation was redesigned not to correct Filipinos, but to support them. Finnish officials began traveling to Manila not as employers, but as listeners. They wanted to understand how the Philippines produced so many caregivers with such resilience. The answer was never found in textbooks. It was found in stories. Stories of Filipino nurses working double shifts abroad to support families back home. Of caregivers singing softly to patients because that's how they comforted grandparents as children. Of workers who endured homesickness, discrimination, and cold winters not because it was easy, but because responsibility mattered. Finland didn't just need hands. They needed hearts strong enough to carry a system under strain, and the Philippines had them. What shocked Finnish policymakers the most wasn't skill, it was loyalty. While many workers from wealthier countries treated Finland as a stepping stone, Filipino caregivers often stayed long-term. They bought homes. They learned the language fluently. Some married locals. Their children grew up bilingual, bridging two worlds. Entire small towns that were once shrinking began to stabilize. Schools stayed open. Clinics survived. Not because of machines or funding, but because people showed up. There is a moment that quietly symbolizes this entire story. In a small Finnish town during winter, an elderly man suffering from advanced dementia had stopped responding to everyone. He no longer recognized family. He refused food. Doctors prepared for the worst. A Filipino caregiver, newly arrived and still struggling with Finnish, sat with him daily. She didn't speak much. She simply stayed. She hummed softly Filipino lullabies she remembered from childhood. One day, the man squeezed her hand. It was the first voluntary movement he had made in weeks. No machine recorded it. No policy captured it. But everyone in that room understood something important. This is why Finland reached out. Today, Finland doesn't advertise that it once begged for help. The word itself feels too dramatic for Finnish culture. But behind policy documents and migration programs lies the truth. When one of the most advanced nations on Earth needed compassion at scale, it turned to a country often dismissed as just labor, and it found something far greater. The Philippines didn't save Finland with technology. They saved it with care, with patience, with humanity. And in a world facing aging populations, loneliness, and burnout, that might be the most valuable resource of all. Not oil, not data, but people who know how to care when it matters most.